are so excited for you to join us for Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. My name is Dr. Ashley Amalfi. I'm a board-certified plastic surgeon in Rochester, New York, and I'm here with my colleague, Dr. Smita and who's joining us from New Jersey.
Hi, Ash. How are you?
I'm so good, girl. How are you?
I'm good. It's so good to be back recording some new episodes.
Yeah, we've got great new content coming your way, and today we wanted to touch on one of our heavy hitters from our Instagram TV show. This is a must listen to before you have your plastic surgery consult. It is the top 5 things that you must tell your plastic surgeon. So not your husband, not your best friend, not your primary doctor, but these are things your plastic surgeon needs to know very specifically because they relate to your surgery. So I'm excited to kind of dive right in.
I know. Well, it's so interesting because I think a lot of people forget that we're still actually doctors and surgeons, right? Because they're coming in for cosmetic surgery, which is actually pretty funny. But you know, there's a lot of things that, you know, people don't either put down on their intake forms or they just forget to mention. But it's all very important. We are, after all, like, our main goal is to make sure you're safe and healthy throughout this whole process. So should we just get started?
Even though this is all fun, it's still surgery and it's serious. And so we don't want to scare you. We just want you to know what you want to tell your doctor so you guys have safe, reproducible results. So ready? What's kind of the first, most basic thing that we want to know, Smita?
Well, I mean, just starting from the very basics is we just want to know your medical history, right? So what medical problems do you have? What medications are you on? Allergies. The other important thing is with your medications, if you're on herbal supplements or other sort of vitamins, because a lot of that we need to know. We might need to stop it around the time of your surgery. And then, you know, any surgeries you've had, medication, I mean, the whole deal, right?
Yeah. Birth control. A lot of people forget birth control as a type of medicine. And we always ask, are you on birth control? Oh, yeah, I forgot about that. That's important.
Right. And I think, you know, that's so important just because it is, we just have to sort of assess your overall health, especially when we're talking about these bigger surgeries where you're under anesthesia and all of that stuff. We might even ask you to get clearance letters from your primary care doctor and blood work and all of those things. I know I regularly do that in my practice, especially if anybody's getting true surgery done. And it's important. Right? I mean, at the end of the day, our goal is obviously to deliver a good result, but to make sure that you do well from all of that. And all of these things are sort of big factors.
Yeah. So medical history. And sometimes it's good to like think about it ahead of time. A lot of your doctors will have like an online portal. It gives you a chance to fill that stuff out before you're in the office and nervous. Or just write a little note on your phone. Like, these are the meds I take. Here's the dosage. These are the surgeries I've had, and just kind of make sure that it's complete, because sometimes in the moment it's normal to kind of forget something that you might think is minor, but it's important for us that it's complete so that we can make sure we're addressing everything that we need to.
Right. I mean, I don't know about you, but I love it when people come in with lists of all their medications and vitamins.
I love a list. I started doing that too, because I take so many vitamins, and then I have the kids, and I kind of forget who takes what, and so I feel like slightly like an old lady, but it's actually really useful, because then when I'm filling out like a new dentist or whatever, I just have a list of everything so that it's very, very easy and everything's very clear, and you know it's completely thorough. And so that's really, like, it's not a bad habit to get into at all. A list is a good thing.
A list is always a good thing. And you know what? It is something just good to have in general, right? Because you never know. God forbid you get into an accident or whatever else. You know, whoever it takes care of you should be able to easily get that information. So a lot of people have, like, I know runners wear like bands with all that information, and there's apps and all of that stuff to store it. But that is number one thing we need to know.
We need to know that. We are doctors. Number 2 is that we want to know what your goals are, because everyone's goals are totally different. So we really want you to think about it, like, not just, I don't like this, but you know, I'm interested in looking a certain way. And so we want you to look at our Instagrams, to look at our websites, and to have a really good idea of what it is that you want to address and what you're looking for, because that's going to help us speak a common language and communicate, right? Do
Right.
you have, do you have your patients like find wish pictures and things like that in practice, Smita?
I do, especially when it comes to breast surgery, because, and when we're talking about implants and things like that, and what may be natural to you may not be natural to me. So I
Right.
think it's important. We can never really deliver that result because our bodies are different and things like that, and your body is going to be different from whatever picture you show us. But at the end of the day, it gives us an idea, like you said, it puts us on the same playing field so that we're speaking the same language. And I think it's so important also is because plastic surgery can only do so much, right? I mean, it can make
Right.
huge improvements in our appearance, our confidence, and all of that, but it's not going to make a 6-year-old look like a 20-year-old or
Right.
whatever the case is. So there are limitations, and we just also want to make sure that your goals sort of meet the appropriate expectations for what surgery can deliver.
Yeah, is it realistic or not? We'll help you kind of look at what you think you're going to get, and we can talk about what's actually safely possible. But then again, that just helps that conversation. So that's really the second thing that we're looking for. What other things do you think you should tell your plastic surgeon, Smita?
So another big thing, especially with plastic surgery, is your smoking history. So I think,
Yes.
a lot of people sort of gloss over it, or they've had other surgeries while they were still smoking and never had any issues. But that is a big thing for us to know because it really sort of decreases our blood supply and our healing abilities after surgery. And with the type of surgery and the incisions that we make and how our surgeries are performed, it can really lead to issues while you're healing. So that is something, any sort of nicotine in your system, whether it's smoking, secondhand smoke, vaping, nicotine gum, if there's high quantities of nicotine, that's important for us to know.
Yep. And with marijuana being legal in so many states, you want to be candid with your doctor about that too, because smoking it can have very similar effects on healing. And so for a lot of patients who are taking that regularly, I'm comfortable with my patients using more of an edible form of marijuana or like a gummy, but the smoking really has the same effect on the blood vessels and the healing potential as cigarette smoking does. And so that's something that you just want to talk about. We're not going to judge you. We're not going to tell you should or shouldn't do something, but when it comes to the safety of what procedures we're actually doing, it's an important piece that some people don't really think about.
Right. And I think it's every once in a while there's a patient that either we didn't know about it or they weren't able to stop smoking. So I typically recommend or require actually that my patients stop smoking 6 weeks before surgery, 6 weeks afterwards. But I've had to cancel surgery if, people cheated and had a couple cigarettes, a couple weeks ago. Because obviously this is a whole, it can be a little stressful. You're having surgery, especially if it's your first time. But one cigarette, you have to reset the clock.
Yeah.
One is too many. So unfortunately, most plastic surgeons will cancel surgery if there's nicotine in your system. So just always be really honest right from the beginning. No judgment. We just want to make sure that you have a safe surgery and you heal well.
Absolutely. So let us know. All right. Should we tackle another one? How about pregnancy history?
Yes.
So, you might kind of allude to this a little bit if you have a C-section, but what we want to know is how many children have you had? How many pregnancies have you had? Have you had C-sections? And then also, are you planning to have more children? And the other thing we want to know is if you have had a large amount of miscarriages, because that can be a very subtle sign that you have a blood clotting disorder as well, which is very, very important for what we do in plastic surgery. So sort of that birthing history and pregnancy history, we're not trying to get too nosy, but it all is very, very relevant because we want to know that we're going to make you look the very best that we can, and especially when we're talking about tummy procedures. If you're going to have a pregnancy soon after, that may really change your result. So we want to make sure that we understand sort of where you are in that timeline. And I think we've talked about it before on here, Smita, like there's no right timeline. You don't have to wait till before kids or after kids. There's no right answer to this question. It's just kind of part of that conversation that we're having.
Right, exactly. Yeah, I mean, you said it right on. I mean, there's no right or wrong, but timing wise, that's something that we can talk about and sort of, if you are planning a family in the near future, well, you might want to wait for your surgery, right? Because revisions are common, our bodies change as pregnancy or not, but we obviously want to have you have the longest result that you can from your surgery. And a lot of that depends on what our bodies look like and the changes that our bodies go through. So that's just a decision, a conversation that we have, and we help you come to the best decision for you, right? We only offer sort of the information. We don't give you, what to do, but that's something that we can talk about.
Absolutely. And so the fifth thing that we want to talk about kind of goes along with pregnancy, and that's weight loss. So we want to know, are you at your goal weight? Are you heavy? Have you lost a lot of weight? Do you want to lose a lot of weight or a significant amount of weight? Because again, for all the same reasons, that can really affect your outcome, because you might end up with more loose skin afterwards. And also, if you've lost a lot of weight, that's going to affect the quality of your skin as well. Do you see a lot of patients who are like sort of mid-weight loss or looking to lose weight, Smita?
Yeah, I mean, I think we all are sort of, right, as women.
Yes.
Right. I feel like we're always
yes.
like, no one's like
who's
100% happy,
no,
right? But
yeah,
the real. So I think every time I ask a patient that, they're like, oh, well, yeah, I want to lose another 20 pounds. Well, I guess the real question is, realistically,
yes.
What are you actively trying to do, right?
Yes.
And also, more importantly, what you can maintain, right? I mean, we definitely don't want you to crash diet or lose weight in an unhealthy way, because ultimately these are lifestyle changes, right? We want you to just have a healthy lifestyle so that you heal well from your surgery, but that also you can maintain that weight and that lifestyle and maintain your results.
Right.
There are certain instances, however, where I would recommend that patients do lose weight, if they have a higher BMI, for instance.
Yes.
And that's mostly related to safety and healing and all of those issues after surgery. So obviously, things that we can control before, we want to control it so that, again, you have the best outcome. How about you? Do you have sort of cutoffs or suggestions
absolutely.
for?
Yeah, we have BMI cutoffs in the practice because we're an ambulatory surgery center. We like to keep patients under a certain BMI just to keep them safe, and it also just makes sure that you have the best result, because the higher your BMI, the higher the complication rate is, and we want to do things as safely as possible. So we'll work with you. There's lots of resources that we have to help you get to that goal weight, but we want you to get to a healthy place before we embark on something like plastic surgery. So those are, that's definitely the top 5 things that you want to tell your plastic surgeon. So medical history, tell us your goals, tell us if you're a smoker, tell us if you're pregnant, have been, are going to be, and then lastly, tell us about your weight. Is it stable, or is there any weight loss planned? And those are the 5 things, right?
Those are the 5 things. Yep. So definitely keep that in mind when you go to see one of us or another plastic surgeon for your consultation. They're going to want to know all this information. So
awesome. So
you
now
guys are better prepared.
5
things. All right, guys. We'll see you on the next episode of Lipstick and Lipo. Make sure you subscribe to our channel so you don't miss any fun topics. We'll see you later.
All right, awesome. See you soon. Bye, guys.